Do you suffer with pain? Are you looking for relief? There is help. Welcome to Back Talk with Dr. Steve Linninger, brought to you by Manassas Chiropractic and Rehab. And now, your host.
Thanks so much for joining me this week for Back Talk with Dr. Steve Linninger. My name is Kimberly Henrie and I am your host, and today we'll be talking about chiropractic treatment for headaches. Now, before Dr. Steve Linninger joins us, just a reminder that if you have questions at any time, please visit us at www.chiropractor-manassas.com. Dr. Linninger, it's great to talk with you as always.
No, it's great to be here. Thank you.
We have an interesting topic today. You see lots of patients, and most of us, I think of, a car accident or a low back injury when they think of going in for chiropractic care. But we're going to explore today headaches. Is it possible to treat headaches through chiropractic care?
Not only is it possible, it makes up a large percentage of mine, and I would assume most other chiropractic practices. So
any type of cause of headaches, or what's the process of kind of breaking that down and figuring out how to treat it?
Well, the first step is the proper diagnosis for the headaches. There's about 5 or 6 different types of headaches, and there's really 3 main ones. There's a tension headache, which is the one that most people common everyday headaches. If you get them on a consistent basis, that's not normal, and there is something that needs to be checked out there. I would say that's the bulk of the patients that I treat are tension headaches. The second most common that I see in here are migraine headaches. Now, sometimes with a migraine headache sufferer, there's a metabolic component as well as a neurological component. Chiropractic adjustments treat the neurological component. The metabolic component can be treated typically by either medication and or addressing the dietary concerns of the patient.
Dietary concerns. Okay, that's in that I would assume is something that you would help with.
Chiropractors have a lot of nutrition training. If a patient's not responding to typical chiropractic care, there's usually a metabolic component, which is where we're going to look at the blood work and the dietary, and what they're eating, what they're drinking during the day. I like to have them do a journal where they track everything that goes into their mouth for a week, and then bring it to me.
And then what do you do with that? How does that help?
Well, it helps me to look at what their diet is consisting of. For instance, the 3 triggers for migraines are cheese, chocolate, and alcohol. So if they've already eliminated those from their diet, we may look at some other issues within the diet. We might want to look at the blood sugar levels. We might want to look at, is the patient hypoglycemic, possibly? Is there an insulin-dependent factor? Is the patient diabetic? Those types of things are things that we are all going to consider when treating a patient for either tension headaches and migraines. Their third type of headache that is not as common but is debilitating, and I've treated a couple of these, is something called a cluster headache.
I've heard of those. Headache. What are they?
Yeah. Well, you don't want one. Let's put it that way. The patient described it like this, and I'll never forget it. Said it feels like someone is on the inside of my skull, and a little person is slamming a sledgehammer against the inside of my skull from the inside.
Nice. Not so nice, really.
No.
Wow.
I can't imagine. I mean, just to put that just sounds horrible. And we were actually able to help that patient, not with just traditional adjustments. We treated that patient with decompression. We did neck decompression treatments on the neck, and the neck nerves at the top of the neck, we've talked about this before, they feed the head. So a lot of times if there's compression or irritation in the nerves at C1 and 2, which are the first 2 vertebrae, the common symptoms of those are fatigue and headaches. So that patient that had the cluster headaches was also suffering from a disc bulge at C2-3. So the disc was impinging on the spinal cord. And that's why we put them on the decompression table, which is it pulls in 2 directions. It stretches out the neck, pulls pressure off of it. And they responded very, very well to that. In fact, that patient sees me continually for maintenance care now that they're done with active care. But just as a preventative regimen, I don't see him very often. He hasn't had a headache in years, though.
That's a great testimony. I mean, I wake up with a headache every now and then just because, I think. But to have those debilitating ones that you've been talking about. I just can't even imagine.
Oh, it's horrible. It's horrible. And that the patient that I'm thinking about, he almost had to leave his career and retire early, and now he's still working.
That's fantastic. I think this question is probably on the tip of everyone's tongue right now, and it has been on mine. When I have a headache, and maybe one that won't go away and I think I need to do something about, how do I decide to go to a medical doctor, a chiropractor, or just go down and get some ibuprofen or acetaminophen or something, or stick my head in the closet or whatever?
That's a great question. And I'll tell you, typically when someone comes to my clinic, they've already done those other
okay.
those other choices. I'm not typically the first, unless they're referred in or something, or someone recommended our care or clinic or me. I'm not typically the first person they've seen for the situation. Typically, they're going to go to if they have a long-standing relationship with some other healthcare provider, they're going to typically go to that person first. It's usually failure that brings them to my door with the treatment from the first or second source, or even the fifth or sixth source that they've attended or it's shown up at the door of. So the real answer is that you don't know. You don't know where to go, and without imaging, without an MRI, neither really does the doctor. So it doesn't really matter whether you show up at your primary care clinic, my clinic, or a specialist. Probably the first thing that any of us are going to do is do an examination. The examinations are similar, although albeit the chiropractic exam also checks the neck, which isn't done a lot. So that's the only difference, is that I'm going to look at C1 and 2 as possible sources of pinched nerves in the area. I may recommend some imaging like an MRI as well. So the answer is, that's up to the individual. I would tell them, of course, come here first, but the individual is going to do what they decide, who they feel most comfortable with, which is probably the better answer.
Okay.
Having said that, typically, if the problem isn't resolved by going to the drugstore and they keep having headaches and they keep taking pills, they're going to get sick of taking those pills.
Right.
And that's where they typically knock on my door.
And I would think at some point that the pills wouldn't be effective anymore.
Not only are they not effective, but there's so many side effects, like there's long-term damage to the liver and the kidney and things like that they can cause. Right.
So
that patients typically want to avoid.
You talked about doing adjustments and looking at nerve damage and food journaling in the case of, say, a migraine. What are some of the other things that someone might expect if they were being treated for headache?
If it's a migraine or cluster sufferer, I typically want to see the blood work. So I'm going to order a CBC if they don't already have one. A lot of times they'll come in with those tests too.
Sure.
In addition to that, I may treat them with spinal decompression machine, or I may treat them with lasers as well in cases of severe headaches.
Wow. So it sounds like you've got a full complement of different ways of dealing with the condition. What's your rate of effectiveness?
I can't think of one patient off the top of my head. I mean, and I don't have a scientific study that tells me exact rate, but I can't off the top of my head think of one patient that hadn't improved, if not completely resolved, their headaches that I've treated.
That's a great track record.
Yeah.
And it's comforting. I mean, as a patient, that's comforting to know that there is some solid evidence that their relief can be had.
Yeah. And there are studies that show effectiveness of chiropractic with treating headaches out there. Plenty of studies.
What about insurance? That's something that we've talked about before, and it's probably time to bring it up again. A lot of us will just go immediately to the MD because that's what we understand our insurance will cover. How does insurance treat chiropractic?
Number one, it depends on the policy. All policies are different. You have to remember that services are what are covered, not the type of provider. So if your MD takes an X-ray, if I take an X-ray, the insurance covers the X-ray.
Okay.
Or if I do an exam, or if an MD does an exam, as long as the qualified person, the insurance covers the exam. So it's virtually the same. There are some discrepancies, and that typically vary by different states.
Mm-hmm.
But what I do in my clinic is when a patient comes in, my office does a full complimentary benefits check of their insurance plan.
So
Yes.
I can just bring in my insurance card and you'll check it out.
We do
for
all
me.
the work.
Oh, nice.
Yeah, because typically when a patient calls and tries to check it, they say, "Do you cover a chiropractor?" And that's the wrong question. You have to ask about each
okay.
individual service. So we'll ask if you cover this X-ray, how many X-rays, do you cover physical therapy? Because chiropractors can, at least in Virginia, we can perform physical therapy and bill for it. We will check all the durable medical equipment that we may be using, the different tests, the different exams that we might be going through. So we do a much more thorough. There's about 30 questions that we ask them when we're on the phone with them.
Okay.
And we do a very comprehensive questionnaire that my staff fills out when they're on the phone with them. So we do that at no charge for the patient.
That's a great service, because it's a confusing world, and it's getting even more confusing.
But in general, I will say that most insurances cover our services.
Mm-hmm. Okay. Well, if somebody wanted to take advantage of that and either check out their insurance plan as in regards to chiropractic or come see you for a visit, how would we reach you?
Well, they're going to call us at 703-396-7770. We can schedule a consultation. They can go to our website at chiropractor-manassas.com.
And what I really loved about your website, I will just give you a little plug, is I did go, and you've got a nice little video on there, so I could get to know you a little bit, and some really great information about what you offer and your background. So
thank you.
Really helpful. Really, really helpful.
Good.
And let's talk about where your office is.
Mm-hmm. We're between Centerville and Manassas on Route 28, and next to Klein's Freeze Ice Cream.
Okay, very good.
It's 8214 Centerville Road.
So here's a funny question: if I get an ice cream headache, can you fix that?
No. No, and you know what's harder is to, if you think it's hard with it coming as a patient and try working next to an ice cream place.
I bet. Well, that just about
temptation.
That just about does it for us today. Can you think of someone who might benefit from what we've covered? They'll thank you for forwarding this episode on to them. And a reminder that if you enjoyed the show, you can share us with your friends on Facebook at facebook.com/Manassas Web Radio. Dr. Leninger, thank you so much.
Thanks for having me.
Thank you for listening. To join a discussion, visit us on Facebook at facebook.com/Manassas Chiro. And to schedule an appointment with Dr. Steve Leninger, call 703-891-9501. That's 703-891-9501.